Hello there, here on Edison TV. We've been following for some time now the progress of Volition, the cancer diagnostic company, and joining me at their London headquarters is Cameron Reynolds, their group CEO. Cameron, ahead of your quarter 3 results, talk to me about the core subject of your colorectal tests.
Yes, well, Triage was the first product which is designed to fit into the national screening programs, fecal testing programs. So it was a good way to get early revenue, we think, but ultimately the big one is the frontline screening test, because that's used by every single adult between 50 and 74 years of age. So that's obviously by far the biggest market. And we've made very strong progress on that this quarter, and we're expecting to finalise the product so we can launch it in Europe very soon next year. And once we have finalised the product, we'll run it through 2 very large trials that are already collected from Danish samples in Q1 and Q2, with the aim of getting CE marking run in parallel to be ready by Q3. And Q3 would mean we could sell the frontline screening test to 150 million people of that age in Europe by the end of the year, which is a huge outcome for us.
So once you've developed the formula for these tests, what's next?
Because we're a very low-cost test that's easy to run and very good for people to do, we wanted to make sure we can be adopted worldwide. So we have announced a very large trial in the US of 13,500 patients, which is the biggest trial ever undertaken in colorectal cancer in the US. We've announced 2 very large trials in Europe of 4,500 and 10,500, and we've just announced 7,000 patients in Asia. This is by far the most ambitious program of trials anyone's ever attempted, and this will really drive the acceptance and demand in those countries.
Let's spin the globe a little bit, round to Asia, and there we're kind of focusing in on Taiwan really, but there are other things going on in Asia as well, and these are affected by what is going on in Europe and maybe a bit by the US as well.
Yeah, we're very excited about the opportunity in Asia. There's a huge population obviously getting much wealthier now. They're starting to have our diet more often, so they're developing more colon cancer, and there's a strong, even stronger reluctance to do a colonoscopy or a fecal test in Asia. So we're working with Professor Chu at the National University in Taiwan, a very renowned institution, to help us collect samples to prove in another large trial that it works in a Taiwanese population. But it's not just Taiwan, he's also collecting samples in Japan and Singapore and looking to develop other ones in Asia at the same time. So again, very ambitious trial. It's costing us next to nothing. Very impressive the way we've managed to work with these groups who, the US trial is costing us $3 million, not expected 30 or 40. The European trials are costing us 1 or 2 million a year, not tens of millions per year, and expect to see the same sort of costs in Taiwan.
We've talked in the past about the thrust that has been happening in DNA tests for cancer, but I gather there's some news, it's a bit of a tangent, that actually is it your nucleosomes or your tests for these could actually be used in different areas. Just explain more to me about that.
The structures we look on the nucleosome, we're looking for, actually look to be very helpful in a range of other areas. We think nucleosomes have always been important for what we do, but a lot of external work now has been done showing how useful they are in a lot of areas of science. Also therapies for cancer, treatments of cancer. So we got approached by a very large pharmaceutical company, and we've now sold them the first of the research kits. It's a research kit, basically it's using the same platform we use to detect cancer for other things. It'll drive early revenue, which is very important. We expect some significant revenue from that next year, 2018, as well as you become very well known. And if they do discover something very interesting with our tests, they've got to come back to us for a product license, which is a huge increase in revenue potential.
Let's almost complete the circle around the globe, stopping off in Namur in Belgium. I was there for the opening, you were obviously there. New facility, you've had new investment from the regional, the Walloon government, and also you've got some new hires out there.
Yeah, we couldn't be happy with where we are in Belgium because it's a great place to work, it's very low cost to be in the heart of Europe, and we're getting a lot of regional support. They love the jobs we bring to the area. They actually help us every single PhD we hire. They pay for 2 years. They've written some very large checks now for multi-millions of dollars in total of non-dilutive funding, so we're not raising more shares. All of this really helps us to make sure, apart from the trials and our technology, we're very proud of the fact that we don't spend very much money at all. about $1 million a month in cash, which, considering we're doing trials in 3 parts of the world, all the work we do, all the discovery work, it's quite remarkable. And it's in no small part to being in Belgium and to getting this funding from the government there. So we're very, very happy with that.
So back here, quite breathlessly in London, before we deal with the milestones looking ahead, summing up the interview, let's talk about numbers, the cash, the revenue. Yes,
we finished the quarter with just over $13.8 million in the bank, and that compares to this time last year, the end of the 3rd quarter, when we had 12.5. So we're in a good position, and we keep very, very tight control of what we spend. It's remarkable, given all the things we do in all the areas we do, to have the very low burn rate we do. We take it very seriously to make sure we use shareholders' money as well as we possibly can.
Whilst I've been looking at Volition, it's always been made very clear that this isn't just about colorectal cancer.
Yes, colorectal cancer is a massive opportunity to help a lot of people through what we do, but the structures we're after on the nucleosome are different in a range of other cancers. We've had great results in pilot studies in pancreatic, in lung, in prostate. So once we've launched in the first half of next year the tests and the big trials in colorectal, we'll refocus on some of the other cancers.
And let's look finally sum up those milestones that we've covered, just to give people a very quick insight, finally, a conclusion as to what's going to be happening over the next year.
So the next few quarters will be as busy as the last few have been. We have now set up trials worldwide for the frontline test. We're in the final processes of developing the test that we can launch for those trials. So expect to see some news in the European trials, in Asian trials, and starting the work in the US, which is being collected now. For the frontline test, which is the big test, also we'll have a lot more information on the triage test and on the research kits and the other exciting developments we're working on. There's a lot of things going on, but we've managed to do a lot of things at the same time on a very, very low-cost budget, and we intend to do the same in 2018.
Well, we'll expect to see you back on Edison TV in 2018. Cameron Reynolds, Group CEO of Volition, thank you very much for joining us.
Thank you, Nick.